Welcome everyone to our podcast. I'm Shamsa bin Shabib and today I'm joined with
Mahar al-Masam. As we know, October is Breast Cancer Awareness Month.
and today we're discussing a very important topic and have three special guests from personal experiences to professional insight. We have a breast cancer survivor, our very own Ms. Zainab, and a person who has a family member battling with breast cancer, Ms. Marwa, and a professional doctor who treats breast cancer, Dr. Rita. So, Ms. Zainab, can you tell us a little bit about when you first discovered that you have breast cancer? What were the signs and how was your initial reaction?
My experience with breast cancer started 6 years ago. Was like a year after I had uh, stopped breastfeeding, and I had regular, discharge, and I always did my self-exam and made sure like everything is fine. Until one day I had like bloody discharge, which was very alarming for me, and I instantly realized that this isn't something that I should just like ignore. So I headed to the hospital immediately, and it started like a set of investigations and testing, imaging, until like a biopsy confirmed the diagnosis.
Dr. Rita, can you please tell us the signs you have encountered while examining Ms. Zainab?
As you know, we always recommend in all awareness campaigns self-examination, even if we are very young, before age of 40. Self-examination concerns all the breast, the nipple as well. And this is what Zainab did, and luckily she found bloody nipple discharge, which made her counsel, and then we did the investigation and discovered the breast cancer. So any kind of change, any kind of symptom in the breast before 40, we need to check with the doctor.
So, Ms. Zainab, how did your family and friends react to this news?
I mean, it was, I would say, tragic, obviously. Like, everyone around you, when they hear the word cancer, they assume the worst. It was a lot of mixed feelings. My kids were very young. My son at that time was 7, my daughter was 2. They weren't in an age where they really understand what's going on. It's the reaction of my parents, my husband, my siblings. It's just like it was very overwhelming in terms of like what's gonna happen now, who's gonna take care of the kids. Like they always assume the worst, but then my reaction toward that was like, I need you. Like I cannot be the one who is holding you together. You need to be the one like who's holding me. Like I need your care. I need your strength. I need your power. So I just want you to be strong for me. I am strong, but I need you all to be strong for me. And this is kind of shifted the perspective, like in the way that they were addressing me. So they started, okay, you can do it. You're strong. All that positive reinforcement that you would need in order to tackle something like cancer.
Thank you. Now, Ms. Marwa, what was your initial reaction as a point of view of a family member?
Yeah, so of course, just like Ms. Zainab just said, it was also a very shocking experience for all of us. Thankfully, my mom had to do a mammogram due to her age, and that's how we caught it. The doctors were very supportive, so that's a really important thing. And I feel the positivity of my mother really helped her get through it and also helped us be positive about the situation. So, of course, whenever you hear a family member has the word cancer, it's just the word itself is very heavy on its own. But knowing that it's breast cancer and it affects a lot of people nowadays is just very emotional, and you just have to learn how to cope with it and how to support that person.
Dr. Rita, as a doctor, how do you motivate and make your patients have a better morale when they find out this news?
So, Ms. Zainab, we know it was a really hard period. So, can you please share with us what has helped you mentally to staying positive and looking on the brighter side?
To be honest, that is a lot to respond to in terms of what helped me through. But I truly believe like the positive thinking and the family are the most important factors. Um, I was, I would say, a very sensitive person. I used to be like very fragile in a sense, and I always like thought of things as in like what would happen and all of that. But then since I had the diagnosis, it kind of shifted my mindset towards I need to be positive, I need to be strong, I can do it, especially for my kids. Like I always had those very few first nights after the diagnosis where like I thought of my daughter since she's young, like 2 years old, that's the age where like you're still building and bonding with your child. And the fact that she's a daughter made it even like more um, heavy for me because I just started thinking about like, okay, this is a very long journey. The daughter always needs her mom. Her mom needs to be there for her, to explain things for her, things that a daughter usually doesn't share with her dad. So all of that just like made me think about like, okay, you're going through this. You've been cautious. You caught it early. You did not wait. So all the indicators are heading towards something positive. Like it's not the end of the world. You're not going to just stop fighting. You need to do it now and you need to stay strong. So it's just that shift in the thinking, the way of thinking, and saying, I will conquer this, I will be able to fight this, I will not give up, made me stronger, like made me think that this is not the end and like I can just move on and I will witness another phase of my life with my kids, grow up with them. And it happened. I mean, here I am, thankfully, 6 years later. Everything is fine. I'm not ignoring any follow up. I'm still, and that's a very important part, I'm still following up with my imaging, testing, making sure that everything is fine and there isn't any sign of.
I think that's very nice, Ms. Zainab, that you were thinking about your daughter and how it would affect her. So, speaking from a daughter's perspective, Miss Marwa, can you please tell us how was it for you mentally, knowing that your mother was battling with cancer, but at the same time being there for her and being like her rock?
Yeah, of course. So especially being the person that was taking her to those doctor appointments and following up with the biopsies and the imaging and so on, we just had to be as consistent as possible. It is normal to feel sad. It is normal to feel overwhelmed, especially when it's such a close family member. However, what is important is that you are just trying to be there for that person and you're trying to be there, especially for my mother. My mother had me at a very old age, so I feel that there is a certain type of connection between myself and her as well. So that's a thing. And then just being as consistent as possible. So even if you're just asking them, well, did you take your medicine? That makes a difference because they know that you care. And even if you're not a verbal person or you don't know how to show your feelings, you don't know how to show your emotions, you're still being there for the person by just following up, making sure they got to their appointments on time. Even if you're just dropping them off with the car and not going inside because you can't handle it, at least you are doing the effort of dropping them off and so on.
So, after talking about the mental effects, how did you handle the physical side effects? What were they? Hair loss, fatigue?
Okay, my kind of treatment was a bit different because, first of all, every cancer treatment is different. So I'm not going to generalize and say, like, this is what everyone would go through. In my case, it was more of I had to undergo a total mastectomy and then I had to go through a reconstruction phase in addition to continuous years of hormonal therapy, which is difficult for someone my age because I was 30 years old who has been placed in a medically induced menopause. So I'm having the symptoms of like 47 or 50 years old woman would have, but at a young age. And it came with a lot of emotional and physical overwhelming parts. And even the mastectomy aspect of like you are losing an organ, and that organ was like somehow the bonding element between you and your kids when you're breastfeeding. It was a lot to take in, but at the same time, looking at it from a positive angle and saying, okay, if this what it takes for me to get over and get done with this, then we are going to do it. The support of the doctor in terms of explaining how does this, or what is this process, what will it look like, what are the possible side effects, helped make me aware. And I think that's a very important factor in terms of knowing what, or just realizing what you are heading to, and not just be in the black or in the dark and not know what's it gonna look like. So my doctor was very thorough in terms of explaining, like, we have to go through this phase because of 1, 2, 3, and then we have to do or take those meds because of 1, 2, 3, and this is gonna help in order to prevent recurrence and make sure that you are protected. So the physical pain is there, but what helps you go through it is just understanding that this is temporary. It's not forever. And this is just you fighting back something wicked and making sure that you win. So losses are there at war as long as the final outcome is winning.
I think that's a very inspiring way to look at things and to look at the treatment. And to go back to something that Ms. Zainab said, that not all cancer treatments have the same symptoms, I'd like to ask Dr. Rita, what are some of the physical symptoms that a cancer patient may go through during treatment, and what are the best ways to kind of deal with them or push through when you are feeling these things?
So this is a very huge question. As Zainab mentioned, every patient is different. It depends on the biology, on the size, on the age, on many factors. Every patient is different and every treatment is different. So usually we meet in a multidisciplinary team with multiple specialties to define what is the treatment for each patient. The treatments can go from surgery to radiotherapy to chemotherapy, endocrine therapy. It can be all the 4 of them, it can be only 2 of them, it can be 3 of them. So it's really different from a person to another, from a patient to another. Now, depending on what the type of treatment is, definitely there are side effects. So it's very important to walk and to explain to the patient all kinds of potential side effects. You know, when you go into a tunnel, the more you put lights, the more you know where you are going, and it is easier will be. So this is why education, explanations, clarification. So this is why we discuss 1, 2, 3, 4, 5 times, as long as it takes, in order to make sure that the patient understood every step of her treatment, every kind of potential side effects. So when she is better prepared, then it will be easier to cope with the side effects. And we have treatments, we have any kind of side effects, we have ways to anticipate, avoid it, or even if it's happening and it's very strong, to treat it and to cope with it and to help with the journey to move through this treatment.
So, Dr. Rita, I think that's a very easy and more understandable way of explaining things, especially the tunnel that you were speaking about. I think you're right. When you're going into a journey and you know what's ahead of you and it's clear, I think it makes it a little bit easier to understand what you're going through.
So, what role does lifestyle play in preventing cancer, like diet, exercise, or avoiding certain habits?
So this is a very good point, and we are trying to work on this point since your ages. We are going now to the schools, highlighting how important it is to change our lifestyle. Healthy diet, exercising are very important in avoiding the breast cancer or other kind of cancers and health issues. So when we run to fast food, to fries, to sugary drinks, this is very bad, and I really insist on that since we are in a school. So adopting a healthy lifestyle since we are kids is very important. exercising, eating everything that is related to fruits, vegetables instead of Snickers, chocolates. I'm giving an example. I have nothing against Snickers. So any kind of fast food, chocolate are not good. Cigarette is not good. They are all factors that were proven to induce breast cancer and other kind of cancers and health issues. So healthy lifestyle, exercise are very, very, very crucial in our life.
I totally agree with you. As someone who is very active, I do believe that we need to make sure that we're healthy and do the things to maintain our health. Even if you're like, oh, this could never happen to me, I still think it's really important that you're aware of things like this. And speaking on awareness, I'd like to see, how do you think like the awareness aspect of people talking about cancer awareness, breast cancer awareness, has impacted it on the bigger picture? And I'm asking as Dr. Rita as well as Ms. Zainab, of like, what are your thoughts on people bringing awareness to breast cancer campaigns?
So what I always tell the campaign, the awareness campaign, every time we give a message, it's like the avalanche. So you give a message to one, then your message will go to your family, to your friends. And this is how the message goes from 1 to 10 to 100 to 1,000. And this is where a patient who was not aware that she should have the mammogram at the age of 40, she gets the message. And then she will come and have her mammogram. And probably we diagnose with breast cancer, as happened, I believe, with the mother of Marwa. So we need to spread the messages, because people who are not aware, then they will become knowing that I have this. I should self-examine myself every month, even if I am 20. It means that I know if there is any change, I wouldn't say it's nothing. I would go to the doctor. I would check it out. Most of the time, maybe it's nothing, but whenever it's something starting at young age, even when we are pregnant, when we are breastfeeding, when we are 20, 30, any kind of change, we need to check with the doctor. And how people know to do that, it's through the awareness campaign. When we get those messages spread around from the schools to university to the society. So this is the importance, how awareness helps in spreading the messages.
I would also add and say, like, when all those awareness campaigns are happening and like the motto is like early detection saves lives, it's not just like a saying. It is real. Like, the earlier you are, the better it is, the more contained it is, the less invasive the procedure and the treatment is. So it is very important. And I think I shared it with our parents last week on our sway. And I said, even at a teenage age group, even like our girls who are in high school, the healthy practice of self-exam, which is just something that you do right after your period, it is very important for your brain. Your brain starts to memorize what are the physical appearances of your breast, and then it builds kind of a map that memorizes that shape. And then if you do that habit monthly over the years, a slight change can be detected. And that means you are at the very early stages of those changes. And that means when you go and seek help, whatever it is, it's going to be less invasive than if you just ignored the symptoms, or even you did not do this habit and waited far too long, and then you go to do your imaging and then it has spread. That's when it becomes very difficult to contain, and like the treatment would be more aggressive. So to avoid all of that, we need to be all aware of the importance of those self-checks, of the importance of the mammograms, of the importance of even looking at your family history. I was the first in my family that was diagnosed, so that sort of alerted my sisters and my mom, and then everyone went on to check, and they were in panic mode. I was only 30 years old at the time, so it was like just very surprising to everyone around. And because of that, my younger sister had in both breasts the early signs that are like still contained within the breast, and she was advised to do what we call a prophylactic mastectomy, and she has done it. And she said, like, I wouldn't have even thought about it if this wasn't something that I had encountered in my family. But then again, within our small, very small community of family and friends, everyone, as Dr. Rita said, it's like an avalanche effect. Everyone started checking. Everyone was like worried because it happened to a close friend. So that's why we need to keep talking about it to everyone around us so that everyone is aware and everyone is not ignoring those checks.
Ms. Zainab, I agree 100% with what you said, and I feel like a lot of people don't understand the reality of a situation unless they've seen it with their own eyes or have experienced it themselves. And that's why I feel like it's so important to spread awareness and tell people how important it is to be aware of these things. Ms. Marwa, as someone who's seen it, being a mother being diagnosed with breast cancer, what changes have you made in your lifestyle and in your doctor checkups, your health, or anything like that because of that?
Yeah, so very good question. Adding on to what Ms. Zainab and Dr. Rita said, I believe like the awareness removes the stigma around doing the bodily checks. So now myself and my sisters, we're doing our routine checks almost every month. If there are any changes, we are following up with our doctors whenever it's needed. I believe sometimes we do get lazy in going and visiting the doctor, but because it's the awareness is happening, the detection signs are posted, you're very informed on the topic, it's really important to like take charge of what is going on and actually go and do those checks with your doctor if you find anything. And even if it's something very simple, don't forget about it. Go check, because at the end of the day, this is your body. You know what your body is supposed to feel like, and that's what you need to be doing. Another change we are doing is I'm trying to eat more healthy. It's very difficult as well with all the environment around us, but trying to eat as healthy as possible, home cooked meals, using the proper amount of oil and so on, and exercise. Again, going back to being lazy, it's something that we all struggle with, but it's just the exercise. Even if you're just going up the stairs instead of taking the elevator, that makes a change in your lifestyle, and that makes a change in how you detect your body and what you need to see in your body.
Ms. Zainab and Dr. Rita, what's something you wish people understood more or better about what it's like to go through cancer?
I wish people understand that cancer is not the end, that cancer doesn't mean death, that cancer sometimes, and I know how tough the word is, but sometimes it is for your good because it changes your perspective about life. It brings the best in you. It brings those survival instincts, and then you become a different person. Me before cancer is certainly different than me after cancer. Just like understanding that we all need to be together in this. We all need to help each other in this. Just like if you have, let's say, a coworker who's going through cancer, or a colleague or a friend, it doesn't mean like you just mark them or label them as like, okay, they're going through cancer, they can't do this, they can't do that. No, just try to normalize and like help them live a normal life, support them, give them all the emotional support that they need, but just don't label them as like sick people who can no longer do anything in life. They are still being able to be productive. They are still be. Sometimes this is a factor that would let them forget about the pain of the treatment, or it let them forget about what they are going through. It's just like another aspect of life that they are still there and they can do things.
So I totally agree. So cancer is a disease. So you can have many kind of diseases in your life probably. So cancer is one of those diseases, and it has treatment. And the kind of treatment is different. When it is earlier, when it is detected very early stages, the treatment is much easier at less than when it's detected at later stages, but there is a treatment for any stage, controllable or not, but there it is. So it is a disease. It will not change the quality of the patient. It will not change the productivity of the patient. You can get sick from another issue, from a liver, kidney, heart, any kind of other issue, where you are tired. Even you can get flu and then you are tired. You cannot be like as productive as when you are in your normal days. So cancer is the same. So you can be sick as any other disease for a few days and then you go back to work. So it is a disease and we should treat it this way. We should handle the patient with cancer this way and treat it as this.
Doctor, do you have anything you'd like to tell people about false interceptions or myths that are made up about cancer that you would like to say are not right?
So if I start with the misconcept, we will not finish today.
Okay, maybe just give us a general idea.
And this in our oriental part. So a lot of people, they like to listen to the false information because it has so many followers on the social media. So we have to be careful with the social media nowadays. We have a lot of people that can spread any kind of information just to get followers. So mammogram is safe. When we tell a patient you need to start your mammogram at the age of 40, and maybe sometimes earlier if they have a strong family history of breast cancer, mammogram is safe. When you travel in the plane to the UK or another country, you have more radiation in the space than inside the mammogram machine. So mammogram is completely safe. The biopsy is safe. So the biopsy, when we want to know what's happening in the breast. This is a diagnostic tool. So the biopsy is a diagnostic tool. So I have two main messages. Mammogram is safe, biopsy is safe, and does not spread cancer. So those are two messages, very, very crucial. And the last one is about the healthy lifestyle. So really we have sometimes, but if I eat this or eat that, it's not about avoiding this kind of fruit, avoiding this kind of food, whatever. You have so many things like coming out in the media. Healthy can be always key. Vegetables, fruits, exercising, any kind of exercise. No need to go through any sophisticated way. So those are important.
Okay, so if you could each share one more message you'd like to tell everyone about cancer, breast cancer awareness, or anything of the sort, please tell us.
I would emphasize again, early detection saves lives. Do your checks, do your self-exam, seek help from the doctor. Do not wait, do not be lazy, because this is your health. And there are people around you who depend on you, so you want to be there for them. You owe them that much. You owe them that simple practice that you do monthly and those annual checks to ensure that you have a high quality life.
So one last message I want to share is to remove the stigma around breast cancer and other types of cancer as well. Do your research, make sure you're following the correct information, make sure you are comfortable as well with your doctors, and be as truthful as possible with them. They are there to help you, and that's the most important thing.
I love those messages so much, so I have only but to highlight them. So follow the right information. Follow the right information. It can come only from specialized doctors. Do your self-examination every month after the period. Start your mammogram at the age of 40, and the biopsy is safe. And also, very important, please try to stick to a healthy lifestyle and exercising. If you have any kind of family history, tell your doctor about it, and we will tell you how you need to have the right follow-up. Please, because early detection can definitely save lives.
This is Shamsa bin Shabib and Mahar al-Ma'sam, and we are here to just remind you of the importance of health and being at your best. And I think it's very important as well to hear other people's stories as you go through your journey of life. Thank you.